This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxier, and welcome to this special episode of Rural Health Leadership Radio. I'm very excited to introduce our guest today. Today's guest is Dr. Dwayne Gunter. Dwayne is the president of QHR Health. Welcome to Rural Health Leadership Radio, Dwayne.
Thank you. I'm looking forward to talking with you today.
Absolutely. So tell us about yourself. Who is Dr. Dwayne Gunter? What's your story?
Well, I live in Nashville, Tennessee, but I'm a preacher's kid from South Carolina. That's where I grew up. And so I played baseball.
You're a PK.
Yeah, PK.
Well, you're preaching to the choir here. We're fellow PKs.
Yep. So I grew up in South Carolina, and then I decided to play baseball in college and ended up in Tennessee. And that's where I've been for 35 years, I think. So I love to fish, golf, and do all those things. So
all right.
Times.
So why did you choose a career in healthcare?
Well, some days I feel like it chose me, but as I was thinking about it, you know, as you get older, you think about things that you really love that kind of spurred your career. And I knew I loved business. I loved leadership. I loved development of people, and I loved service-oriented professions. And so healthcare just provides itself for kind of coming together of all those things. And it just is a perfect fit for things that I find that drives me and drives passion in myself. So
wonderful.
That's how I saw it.
And do you still get to fit any baseball into your life?
I did for a long time. My kids are grown now, so I'm trying to find another child to live through to maybe coach again. So
awesome. Yes.
I'm just on airplanes so much, it's hard to coach from the sky.
Yes, but it's amazing how you can live vicariously through those young folks, isn't it?
Yep. That's what I'm picking one of the nephews or nieces and their children to start figuring out which one I'm gonna coach.
Yeah. All right. Well, that tells us why you decided to focus on healthcare as a career. Why are you focused on rural health?
You know, it's kind of interesting. In rural health, it's obviously very community driven. And if you think about what we just went through with my background and growing up, I saw as a preacher's kid firsthand communities, and I saw the needs of communities, not only from a spiritual standpoint, but also from all the needs. Because one of the things in growing up in a rural community, I saw the needs and how people work together, and it's just, you know, it's just impressioned on my heart from the beginning, and that's how I see rural health. I see it as a community. It's a community conversation. It's a community need, and so it drives me because you're solving a need for that community and pulling people together.
Certainly, yeah, that makes sense. So as you know, the name of this program is Rural Health Leadership Radio. And I emphasize the word leadership, and you talked a little bit already about how leadership is important to you. What's your definition of leadership?
Yeah, it's you know, when I think about that, back in the 90s, I had this idea I wanted to be a professor. And so I ended up going to doctoral school and getting my doctorate in leadership. And as I was working through that, I kept working in the business career, and the business has carried me through. But during that time, I had a lot of time to reflect on what is leadership and what's my definition, and what's really driven me. One I really liked was the art of mobilizing others to work together for shared struggles. And you know, it's a book I read many, many years ago, but as I worked through that, it begins to be that leadership foundationally is about relationships, and it's not about titles, it's not about structure, it's about relationships, and people have a choice to follow a leader. And so you have to work through how to freeing up people to do their best.
Yeah, great. I like the use of the word art in that. You know, that's kind of cool too. So thanks for sharing your definition. So you're the president of QHR Health. Can you give us an overview of your organization and the community that you serve?
Yeah, I'm privileged to be here. I came here a few years ago, and it's a company that's been around for over 4 decades, and it started at the heart of rural communities around this country. And so one of the things about us is our organization is very focused on strengthening independent community healthcare in this country. And that is our drive every day, that everybody that works here, we wake up, the one thing on our mind is strengthening independent community healthcare. And so we build every offering, everything we do, our culture, everything is centered around that goal and that objective. And so we have services that support that initiative, from operational support to financial to technology, all those things to drive economies of scale to independent community healthcare in this country.
So, so any hospital can reach out to you and utilize your services then? Is that how it works, or?
Absolutely. We have, today we have an association in all 100% rural. We have over 15 billion in net patient revenue that we serve every day when we wake up in rural communities across this country. And we can do everything across the footprint of a hospital and helping them, from everything from recruiting physicians to compliance to financial benchmarking and support, and providing even CEOs and CFOs to help them, and including supplies and the ability to drive savings in supplies as well.
So it sounds like you're a solution center. If rural hospitals got questions and they're not sure what the solutions is, they can turn to QHR?
Yeah, it's, one of the things I like to describe it as is it's a shared service center approach. And so the ability to drive economies of scale, a lot of times rural community healthcare, being independent, doesn't have the privilege and the opportunity to drive the value of scale to their business. And so somehow they've got to get scale. And that's what QHR does through our shared services, ability to provide scale to a independent community healthcare.
Okay. All right. Great. Thanks for explaining that.
Sure.
Everybody's been talking about the COVID-19 pandemic, right? It's really turned our world upside down. What's the impact been on your organization?
Well, just like everyone else, our hospitals have obviously experienced a very drastic decline in revenue.
Right.
And so it's been very impactful from that standpoint. I would say for the most part, most of our rural communities, it hasn't been a high number count when it comes to COVID-19, but due to the way we address this pandemic, it removed services and shut down services to our rural facilities, which impacted revenue, which impacts a lot of things. That impacts all the way through the organization. So the way we've addressed that is we established a number of task forces to address everything from financials to supplies to other areas. And so one of the things, for example, we're very strong in supplies for hospitals. And so we've already immediately, within the first week or so, we had to ramp up our own warehouse. We had to start buying PPE products, and we are now shipping products on a weekly basis. And that's something we weren't in that business pre-COVID. Now we're in the warehouse and shipping business. And whereas we were more real time pre-COVID, now we're moving to more of a stockpile approach for our clients so that we can be prepared for what might come in the future. The other thing is now we have to shift into thinking about post-COVID and what life looks like. So we've written a COVID playbook that our clients are using on how to transition to the next phase of healthcare, which people are loving and utilizing. And so we also have, and I'll tell you on a personal basis, I think the thing that I'm looking into the most is the impact of behavioral health. Behavioral health is always a number one needs assessment across rural communities in this country. And QHR is looking heavily at how we might address that. We believe that COVID-19 is going to continue to impact the behavioral side of healthcare. We've all read the articles on what that means, and we're very concerned and very passionate about how we help rural communities deal with this.
Yeah, I think that's a great point, because I think too often behavioral health gets kind of swept under the rug the way it is, and this pandemic is kind of bringing those issues out more so. So we got to be prepared, right?
Absolutely. I mean, rural health. It's an issue, but it's a financial one that's hard to scale their hospitals to cover behavioral health. And we're trying to look through our shared service centers how we might support one-to-many kind of relationships when it comes to behavioral health. It's a passion of ours. So we're working through it and trying to figure more of it out, but we're going to figure it out because it's a huge need.
Yes, important work indeed. So why is rural health so important to QHR?
Well, as I said earlier a little bit, it's 100% of what we do. We don't try to go into other markets. We don't try to go up market. We are 100% focused on rural communities across this country. That is for 40 years. That's what we do. And we're zeroed in. We know what we want to do. We know what we're really good at, and we know where the need is. And that's our focus. And as I've told many hospital boards across this country, you either choose to work with QHR Health if you're a rural community, or we don't exist, because that's our only focus. So we wake up every day hoping that rural communities want our services and want to work with us.
Yeah, because that's a bit unique, because most companies or organizations, they may be focused on rural, but if a large urban facility called them, they wouldn't turn them down for business opportunities.
Yeah, and I understand. I've worked, in my career, I've worked for some very large organizations, like Hospital Corporation America. I worked there for many years, and I understand what large looks like.
Yes.
And they have their mission and their purpose as well, but we know our purpose, and our purpose is to serve rural communities. And that's not always is a large dollar return to us. And because you can only work with the dollars afforded you by that community, and you have to work within that framework. You can't go in and add a bunch of zeros to your services. You've got to work within the economics of that community.
Right. Okay. So if a rural hospital CEO or any rural health leader for that matter decided that, hey, we've got some problems that we need some outside help for to figure out the solutions here, whether it's for technology or just some of the financial metrics, some of the services that your organization provides. What are the top 3 things that a rural health leader needs to look at when they're making a decision on who they would want to partner with for those services?
Well, if I'm a rural community facility, you've got to start thinking about, instead of buying point solutions, you've got to start thinking about what solutions will drive me the best leverage and economies of scale. As I mentioned earlier, you need leverage. It's hard to scale. It's hard to stay in business. It's hard to drive the cost structures you're going to need to run a hospital without economies of scale. And a lot of times rural communities have chosen a path here recently to partner with large tertiary or larger health systems, and believe that fills in gaps in care, and that gives me some relationships to tag onto their economies of scale. And I understand that path. I have my pluses and minuses of why that might work, might not work. And just to highlight one of those, my concern when you partner with large tertiary is that when you refer a patient into their network, their workflow is not designed to ever give you that patient back.
Right.
It's just not designed that way. It's not their fault. It's not they're vindictive. It's not that they are trying to build a bad relationship with you. It's just they're not designed from a workflow standpoint to ever let one of their patients walk back out of their network. And so, whereas working with QHR and thinking about economy scale, our 100% focus is on how do we retain that patient into your network and drive and take care of that patient, drive a solid patient experience into through your brand and through your location. And so you've got to consider that you need economy scale, you need leverage. And the last thing I'd say is how to engage that consumer or that patient and into more services, and to make sure you're looking at the 360-degree view of that patient need as they move through life.
Gotcha.
And so that's how a lot of times we're thinking about, how do you do rev cycle, or how do you do this? And we need to move our minds to how and what are the needs of our consumers and our community that we're serving and the people we're serving, and then let the business evolve around that.
Right. That makes sense. Absolutely. So how will technology impact rural healthcare?
That's a great question. My background, I'm a former CFO, but I'm that CFO that was in technology, and so I'm very passionate about technology and healthcare. And I still advise or communicate with some very large health systems in this country, and I see what they're doing from a technology standpoint. A lot of things around automation, a lot of things around digital, uh, just just a lot of things around predictive data type things, and talking to the patient, understanding the patient, being engaged with the patient. And these things that they're doing are very expensive technology platforms that, for the most part, a rural hospital is just trying to figure out how to afford the next module for their electronic health record,
Right. Right.
or how to even get an EHR optimized. And unfortunately, I know a lot of rural health leaders wouldn't want to hear this, but EHRs are kind of table stakes these days. They're just the basics of what you need from a technology standpoint moving forward. So QHRs, we're designing our next level of investment on how we can create more what we call power plants or platforms from a technology standpoint. And then we can rent those out to rural healthcare, and they pay for power and not have to spend millions of dollars to buy the platform.
Okay.
And so we've got to figure things out. Just like if you live in a rural community and you see the utilities and there, nobody builds their own power plant. Somebody's building it for them, the city or somebody, and then they rent the power. We're trying to come up with that model so rural health can move faster in technology, but move faster with affordability.
Yeah, I mean, the technology is definitely a challenge for rural healthcare because of the cost, as well as
Absolutely.
having the expertise, the local expertise that you need to deal with technology. So, what are some of the best practices that you've seen some of the top rural health leaders embrace around technology?
Yeah, some of the practices that I see is how to utilize technology to drive productivity improvement. A
Okay.
lot of times, I think when we first got in, and this is a little soapbox for me, and we got all mandated to go to EHRs, really what we did was we converted EHRs and we used them to convert our paper file cabinets into an electronic file cabinet,
Right.
and called it success.
Right.
And that was not success. The ability that you said you went from paper to electronic, and now you can get rid of your file cabinets, but now you got it all sitting in a computer, and but you did not take the time to improve your productivity or your workflow or add more automation so that you could take care of patients, or you could add more patients, or you could scale volume. You pick your need. And I just think that that's what we need to embrace more of, is how to leverage technology to improve the business versus just file the business, so to speak.
More than checking a box, that's for sure.
Exactly.
Yeah. Okay. Great. Thanks. So, can you've talked about how you help rural leaders, rural hospitals, rural health organizations. Can you give us an example of one of your clients or customers and the impact that you've been able to make on them?
Yeah, that's we've got a number of them because we've been in business for so long. But
Right.
there's some recent ones here. We had one in the New Mexico area where we went in and brought our management structure, our 52 best operating practices, and our whole team approach with shared services. And this hospital was, borderline closing down. They had plans to build a new building and different things like that. And you fast forward, we brought the approach. We partnered with the community and the board and the team. It's not about us only. It's about a team approach with the community and with the board. You've got to sit down and talk about the objectives. And that one, I look now, a few years later, they're in a brand new building. They're moving into phase 2 of that building. They've got plenty of cash on hand now where they didn't have any cash. They've got improvements to their accounts receivable. They've got improvements to their culture. They're getting service lines back on board, and so recruitment with physicians and all those things. So but the key there is you walk into these situations, and there's a number of them in this country where we hear it all the time. Rural hospitals on the border of line of closing versus surviving versus thriving, right?
Right. Right.
And QHR, we walk in and look at all three of those categories. Because if you're thriving, there's more things you need to prepare for in the future. If you're just surviving, you need to obviously evaluate some areas so you can move towards sustainability. And if you're in the process of closing or fear of closing, there's a number of things you can do that we focus in on. And another example, in California, we went in, hospital was losing money, they had no cash on hand, and I fast forward to, I was there not long ago, they've got over 400 days cash on hand.
Oh, wow.
They're making 20% margins now in the business, and we're contemplating adding a new building next door to grow the business. They got a rural health clinic in play, and both of these examples I'm giving are critical access hospitals. I mean, they're, and I could give you larger 100-bed hospital examples, but those are two we're proud of this last year. But we've got many. You know, we can go into every hospital and say, look, here's a positive. You got to, you know, there's enough negative going around in rural healthcare and even healthcare in this country, but there's a lot of great things going on too, and I'm very passionate about the future of rural health in this country.
Yes, sounds like you're doing some good work to fuel that passion too. So that's pretty cool. So you've been around a while, working in healthcare and rural, being focused on rural healthcare, especially with QHR. So you've got a good perspective for my next two questions I want to ask you. What scares you the most about the future of rural health?
Well, I'll tell you, I'm looking at your backdrop here, rural health leadership. My number one thing that scares me right now is leadership.
Okay.
One of the great things about QHR is we have a QLI. We call it the QHR Learning Institute. It's been around for many years. We trained over 4,000 people last year, and we are enhancing that. We don't make money on that. It's a cost basis solution for us, but we are investing in more boot camps, more physicians. We're looking at adding partnerships on master's degrees. We're looking at more leadership coaching development. We just believe, and I personally believe this as the leader of this company, is that we have to invest in the next generation of leaders. I see the age, no offense, I'm one of them, but I see the aging of leadership, and we have not done a great job in rural health to develop the next generation of leaders that are going to take over these hospitals. And shame on us maybe, but it's time we invest in this. And that's why I'm so passionate about the NRHA and what they're doing around leadership and the focus to invest in the next generation. We're running this race right beside NRHA and believe that we need to make the investment in this. We got to move it from lip service to investment and make things happen.
Absolutely.
So that's the one I'm most passionate about. That scares me every day I wake up, is the leadership side of things.
I hear you on that one. No doubt. So let me flip that question around for you. What excites you the most about the future of rural health?
Well, one of the things I've been doing and looking through QHR, and you think about it, we've always been thinking about hospitals, like number of sites. We say, okay, there's the X number of critical access hospitals in this country. And when you've talked to somebody about rural health, they'll say, well, there's so many soul communities, so many MDHs in the country, so many critical access in the country. And I want to flip that. What excites me is when I've done an evaluation of our sites across this country, and we have 1.5 million consumers attached that are walking into our hospitals every week across this country. 1.5 million people.
Okay.
And we have to start. What excites me is our ability to start thinking about those 1.5 million people and their healthcare needs, and how do we build rural health in this country to address the needs of those 1.5 million people inside of QHR. So that's a passion for me. It excites me, and I'm trying to shift our culture and our thinking and our leaders into thinking about those people and how do we serve those. And the challenge is, there's all kind of challenges. How we're going to pay for that? How we're going to get paid for that? How are we going to have money to support that? I think my passion and excitement is we'll figure that out. Right. Because we've got to move and align as I say often, we got to move and align our bricks, our clicks, and our services to meet the needs of these communities.
Run that line by me again. I like that.
Yeah, I said we got to move our bricks and our clicks and our services to meet the needs of the people in these communities. And because it's not just about bricks anymore. There's also,
Right.
as we learned during COVID, there's a lot more about clicks now, right? We're
Yes,
clicking the
absolutely.
buttons and talking to our doctors. So
Yes.
so we got to think about all that.
Yeah, very interesting. Thank you for your insight on that.
Sure.
Dwayne, the time has kind of flown by here. We've covered a lot of ground in our conversation. If our listeners only take one thing away from this conversation, what should that be?
I talk a lot of investment community people around this country, people that have money, people trying to invest in healthcare, and I go around and trying to talk to them about investing in rural health. Many of us leaders, that's what we're trying to do, is get people to invest in rural health, put
Right.
dollars in, build new hospitals, put technology, do different things in rural health. And I spend a lot of time with investment communities. And the one thing is when they're asking me is, well, we hear rural health is closing or sites are closing. And I got one message that I tell people all the time: rural healthcare is not closing. And if I could leave one thing for this community and people that might be listening to this, is that rural health is going to survive. It's doing well. It can do better. And we're all going to work together. And one thing people can count on is that QHR Health is focused on providing strength to these independent community health cares in this country. And we are going to partner and run this race, and we're going to find money, and we're going to invest along with you. But it is not closing. And it's shifting, or it's transformation, whatever word you like to use, but it is evolving to the next generation of what it's becoming. And I'm pretty excited about that. So,
Dr. Dwayne Gunter, president of QHR Health, thank you so much for joining us here and sharing your perspectives, your knowledge, and your expertise on leadership in rural healthcare.
well, Dr. Bill, it's a privilege to spend this time with you, and I really appreciate you doing this, and I look forward to meeting you one day.
Yeah, absolutely. And for those of you listening, if you'd like to connect with Dr. Gunter, you can find his contact information in the notes below this video. Worst case scenario, just reach out to me and I'll connect you with him. You can learn more about QHR Health by visiting their website, which is pretty simple, QHR.com. And if you'd like to learn more about Rural Health Leadership Radio, guess what? We have a website too, and that's rhlradio.com, or simply use your smartphone and the podcast app to look up Rural Health Leadership Radio and subscribe. If you enjoyed this special episode of Rural Health Leadership Radio, or you know someone who might benefit from what Dr. Gunter was talking about, please share it with them, because we're all here to serve you. Until next time, let's keep working to improve rural health, one conversation at a time.